This is second basic and fundamental lecture. Please listen carefully. Electrical conductive system. Apart from myocardial muscle, heart has got a specialized conductive tissue, and it is responsible for generation of impulse and propagation of impulse. Then this electrical system is also known as junctional tissues of the heart, conductive system or the junctional tissue of the heart. Now remember that in right atrium there are two very important conductive tissue. One is sinoatrial node or SA node, another is known as AV node or atrioventricular node. These are the two spontaneous electrical generation spots. SA node is bigger than the AV node and is situated in the upper part of the right atrium near the root of superior vena cava, while AV node is situated near the tricuspid valve and it is near to the mouth of coronary sinus. It is half the size of AV node, SA node, half the size of SA node, the AV node. Then SA node is connected to the AV node through three internodal branches. Then if you see, SA node gives a small branch to the left atrium, and that is known as Bachmann bundle, which causes electrical activity in the left atrial wall. Now, we know that the heart has got two masses of muscle. One is atrial mass, another is known as ventricular mass, and in between is a fibrous ring. So there is no muscular continuity from the atrium to the ventricle. Then how the impulse will go down? From SA node to the AV node, the impulse has come through three internodal branches and in the from the wall of the atrium. From AV node, a small structure crosses the AV ring, pierces the AV ring, and comes to the ventricular side in the septum. Now, this is known as bundle of Hayes. Then the bundle of Hayes comes down in the membranous part of the interventricular septum, and it divides into right and left bundle branch. Now, the right bundle branch is thinner. The left bundle branch is thicker. That is why in some normal cases it can be blocked, and in ECG it may show right bundle branch block. Then these bundle branch will go down into the muscular part of the interventricular septum, that is the lower part of the septum, and it divides and becomes very thin, fibrous twitches, which terminates and cause a stimulation of the ventricular myocardium. Rather, it is very difficult to separate the right Purkinje fiber from the myocardial muscle. Now let us go back again for some important fact. SA node is also known as pacemaker of the heart. Why pacemaker? Because it initiates the process of impulse formation. Now remember one thing, heart has got no motor nerve supply. It is supplied by autonomic nervous system, sympathetic and parasympathetic. Sympathetic nerve is supplied by deep and superficial cardiac plexus to the all parts of the myocardium. But the parasympathetic supplies SA node and AV node. The SA node is supplied by right vagus, while AV node is supplied by left vagus. Now, these places are is generating impulse, and then the process of depolarization and repolarization, impulse will spread all over the cardiac muscle. Now coming to the AV node. And another thing to remember, that SA node spontaneously discharges at the rate of 60 to 100 per minute, while AV node is half the number, that is 40 per minute. Now the AV node is a smaller in size, also a right atrial structure, which is smaller than SA node, supplied by left vagus, and it discharges impulse at the rate of 40 per minute. Another very important point to be remembered, when SA node is discharging impulse, AV node will not discharge impulse. It will be under control of SA node. So what is the use of AV node? Use of AV node is that it is a important junction. Then another thing is, supposing due to some disease condition, SA node is knocked out, then the AV node takes the charge of a spontaneous depolarization. Now, the other point in AV node to be noted, that AV node has got a extension down as bundle of His. This bundle of His crosses the fibrous ring. So what is AV bundle? A bundle of His? Bundle of His is a sort of electrical bridge between the atrial mass and ventricular mass. Now, bundle of His will go down into the septum, membranous part of the septum, and then it divides into right and left branch when it reaches the muscular part of the interventricular septum. So at the level of muscular part of the interventricular septum, it divides into right and left branch. Then these branches, although right is thin, left is thick, and it gives branches. It divides into, right bundle branch divides into 3 further division, which we will discuss later on. Then ultimately the bundle of His divides and redivides and form Purkinje fiber, which is the termination of fiber which enters into the ventricular muscle, and there it excites ventricular muscle and cause depolarization. One more important point to be remembered, conduction velocity in Purkinje fiber is highest, and conduction velocity in SA node and AV node is slowest. Purkinje fiber conducts at the rate of 4 meter per second. Please remember this fact. Thank you.